This very popular video from Dr. Eric Berg came up on my YouTube feed, so let's find out what the best remedy is to prevent a heart attack, and then explore the evidence. A quick note before we begin, we're only going to focus on the health advice provided in this video, and whether the evidence supports that advice. I don't know much about Dr. Eric Berg, aside from that he's got a very successful YouTube channel. This is not going to be a destroying video or any personal attacks, it's just going to look at the evidence, which you can then examine when you're making up your own health decisions. I'm not here to convince you of anything.
I want to talk about, hands down, the best remedy to prevent heart attacks, okay? And you're going to be asking yourself, why have I not heard about this before? Why isn't this in the news? Well, because there's no money in it. That's really the bottom line. Who's going to promote it unless they make money on it? No one. A bottle of this remedy, which has hardcore scientific data to show that it can prevent heart attacks, is only $3.19.
So I wonder if he's going to be talking about statins here, because rosuvastatin, 5 milligrams, it costs $3.60 from costplusdrugs.com. Let's see if I'm right.
Okay, $3. So if you say you can't afford it, well, I think you can. Now, I'm going to put a lot of the research down below. One study called the Coronary Drug Project.
Yeah, so what I like about this, any health advice that you see online, we need to make sure that it's referenced. So it's awesome to see that Dr. Eric Berg references the studies that he's quoting. So I've just pulled up the study that he's referring to, and it's talking about niacin, so vitamin B3. So it's not statins.
Which was placebo-controlled, used this nutrient, okay, to show incredible results. But the remedy is niacin. Now, it's funny because my dad had heart problems. He had a pacemaker, had atrial fibrillation. And without my recommendation, he chows down these niacin tablets like all day long. And he seems to be doing pretty good.
So niacin used to be used in clinical medicine to lower cholesterol levels, but the evidence behind that, it was lacking. So it'll be interesting to see if Dr. Eric Berg goes through the study in detail, which doesn't look like he does. So I think let's just go through it together. So I've just gone through this. The link that Dr. Berg provided, it was a commentary about the Coronary Drug Project. So I think it's important that we actually go through the Coronary Drug Project itself to see what the results showed. So it was a study published in 1975. It was looking at different potential cholesterol-lowering medications, and it was sponsored by the National Heart and Lung Institute. When we open up the paper, we can see that it involved 53 different clinical centers and involved over 8,000 patients. So they were randomly assigned to 6 different treatment groups. And one of those groups was 3 grams of niacin a day, and another group was a placebo. And on average, the patients were followed up for 74 months. One of the first things that the paper comments on is the high dropout rate for niacin. So it's about 14.3%. So when you take niacin, you get the niacin flush, and some people find that really uncomfortable. If we move to the results, so if we look at mortality or death rates, the death rate in the niacin group was 24.4%. So that's almost a quarter of patients in the niacin group who sadly passed away during the study, and it was roughly the same for placebo. And overall, the death rates between the people who took niacin compared to placebo, those differences, they were not statistically significant. So I wouldn't say that this paper is a glowing endorsement of niacin. Niacin did not appear to reduce the chance of death, and in the study, a lot of people unfortunately passed away. When we specifically look at heart attacks though, there did appear to be a small reduction in the amount of heart attacks that were happening in the niacin group compared to placebo, so that's quite interesting. But it's a bit difficult to interpret those results because the niacin group, they're unblinded. So in a perfect world, the participants, they don't know which group they're in, they don't know which molecule they're taking. But because of the niacin flush, patients are going to know if they're in the niacin group or not, so the results may be confounded by the placebo effect. And this is where a belief in a treatment, it may be enough to change the course of a person's physical illness. What's more worrying though is the side effects that were found in the niacin group. So yes, most of them included a rash, so the niacin flush, which we've already talked about, but they also included other things, such as gastrointestinal and urinary tract symptoms. There was an elevation in uric acid, there was increases in gouty arthritis, there were increases in blood sugar levels and liver enzyme levels, there were also increases in atrial fibrillation and other arrhythmias of the heart. So from this paper that Dr. Berg has quoted, niacin might be making his father's arrhythmias worse. Just to read the conclusion of this paper that Dr. Eric Berg is referencing in his video, it says, in conclusion, the coronary drug project data yielded no evidence that niacin influences mortality of survivors of myocardial infarction or previous heart attacks. This medication may be slightly beneficial in protecting persons to some degree against recurrent non-fatal heart attacks. However, because of the excess incidence of arrhythmias, gastrointestinal problems, and abnormal chemistry findings in the niacin group, great care and caution should be exercised if this drug is to be used for treatment of persons with coronary heart disease. So I wouldn't say that the papers that Dr. Eric Berg is providing is a glowing endorsement of niacin. I did a bit more research into this study, and there was a secondary follow-on study that was done. This study looked at those original patients who were in the coronary drug project, and it followed them up for 15 years, so nearly 9 years after the termination of the original trial, and mortality from all causes in the drug groups except for niacin was similar to that in the placebo group. So here's where things get interesting. Death rates in the niacin group was 11% lower than the placebo group. When we dive a bit deeper, these data are derived from men recovered from heart attacks who were prescribed 3 grams of niacin daily for an average of 6.2 years, then presumably stopped taking the drug. So it's following these patients up, and they aren't taking any additional medications, including the niacin. They are not taking the niacin during this follow-up. The available data relates only to the use of niacin for 5 to 8 years in survivors of heart attacks. There is no information on whether longer-term niacin usage might be helpful or harmful. So it's not exactly a glowing recommendation to use niacin either. So hopefully Dr. Eric Berg covers this in his video. So let's go back to that.
But there's a lot of research on niacin that goes back decades. And you want to get the niacin that gives you the flush. I would recommend an extended release niacin at 500 milligrams.
So that's a bit odd because that's not the dose that was used in the study that he was quoting. Remember, they used 3 grams a day, so not the 500 milligrams that Dr. Berg is recommending.
And do at least one a day. All right, so let's talk about what it can actually do. It significantly lowers your cholesterol, specifically oxidized LDL.
Yeah, so that's what they found in that study. But again, what they were specifically looking at in that study that Dr. Berg was quoting was whether it would reduce heart attacks and whether it would save lives.
Okay, that's the type that creates inflammation. It has potent cardiovascular protection.
I'm not sure about that statement. There were a lot of people that were still having heart attacks in the niacin group from the study that Dr. Berg quoted. It's also difficult to know whether that was because of the placebo effect or a true effect of niacin.
It's been found to lower the white blood cell reaction in the inside of your arteries, because when your body is forming plaque in atherosclerosis, you have an immune part of that as well that is usually responsible for inflammation, which we don't want a lot of inflammation in our arteries. Well, niacin.
So while that's true, we don't want a lot of inflammation in our arteries. You don't necessarily need inflammation to start atherosclerosis, so the process of blockages in our blood vessels.
Decreases monocytes and other white blood cells and the inflammation that comes along with it. Niacin significantly lowers something called CRP, C-reactive protein. C-reactive protein is a strong predictor of mortality.
Yes, it's a bit difficult to say that. So there's this thing called inflammaging. So when we age, there's a general increase in the amount of inflammation that we've got in our body. So CRP tends to go up. So CRP does correlate with death rates, but it also correlates with increasing in age. I think it's also to keep in mind that it's the hard outcomes that really matter, as in, will niacin reduce heart attacks and save lives? It's very easy to get bogged down in this mechanistic reasoning, as in how we think niacin should provide these benefits, but what really matters is the hard outcomes. And as concluded in the coronary drug project that Dr. Eric Berg is referencing, when it comes to niacin, great care and caution must be exercised if this drug is to be used for the treatment of persons with coronary heart disease.
C-reactive protein is a very strong independent predictor of heart attacks, or you can call them myocardial infarction, peripheral vascular disease, and stroke. If there's high levels of C-reactive protein in your body, you have inflammation, okay? And niacin can help squash that. You see, when a clot forms or plaque forms in the arteries, you always have first this oxidation going on.
So let's go through that, because you don't necessarily need inflammation or oxidation before atherosclerosis can occur. We've known since 1993 that it's really about a concentration gradient. So if we've got high levels of blood lipoproteins, that generates a standing concentration gradient that then allows those lipoproteins to cross into our blood vessel walls. As stated by one of the world's leading lipidologists, William Cromwell, he says that the native LDL particles, they move into the artery wall as a function of concentration over time. The longer the LDL particle number is elevated, the greater the entry into the artery wall. He further goes on to say that statements such as this one, claiming that nothing will permeate through the artery wall unless it is damaged, is incorrect. Overall, your blood vessels do not have to be inflamed for atherosclerosis to occur. You can still get blockages.
Well, guess what? Niacin suppresses that oxidation. It acts as a very powerful antioxidant, as one of the things it can do. And I think the biggest thing why it's so powerful is it gets rid of vascular inflammation. And it prevents the lipids or the fats from depositing on the arterial wall. It also
Yeah, so as we've gone through, that's not quite correct, and that's not what the Coronary Drug Project showed. There were still heart attacks that were happening in the niacin group, and it didn't seem to save lives in that original study. It was only during that longer follow-up time, where the patients weren't taking any drug, that there seemed to be a mortality or death benefit.
also reduces triglycerides too. And at the same time, it increases the HDL. So niacin has the power to slow and reverse arterial sclerosis.
Again, not correct based on the evidence that Dr. Berg has provided.
And I know you're wondering, why haven't I heard about this? Why isn't this promoted all over the place? Well, like I said, there's no money in it. Niacin can decrease the mortality risk in people that have cardiovascular disease.
I don't want to keep nitpicking here, but that's not what the studies showed that Dr. Berg is quoting.
Niacin tends to prevent dysfunction in that inner layer of the artery called the endothelial layer, which is where it all starts. And it significantly reduces the adhesions that form in that wall. Now, on the flip side, a lot of people that have high cholesterol are taking statins. So let's just kind of touch on that while we're on the topic. So it is true that statins do block and lower cholesterol, okay? But there's no evidence that it reduces the risk of getting heart attacks.
I'm slightly baffled by that. We've got numerous studies showing that statins reduce heart attacks, so we'll just go through a couple now. Starting with this meta-analysis involving 34 trials, and overall it showed a progressive lowering in heart attack rates when we lower LDL cholesterol. And we can see from all of these studies that the more that we lower LDL cholesterol by using statins, the lower the chance of heart attacks.
Basically, statins work by blocking your body's production of cholesterol. The problem with that is that to make bile salts, you need cholesterol. And without bile salts, you can't now absorb vitamin A, D.
So statins don't completely block your body's ability to produce bile salts. It's also crucial to remember that the cholesterol that's measured in the blood, it's only a tiny fraction of the body's total cholesterol levels.
E, which is very, very important. K1, K2, which is another vitamin that's very, very important keeping the...
So if we're worried about safety, let's have a look at the best available data that we've got. So we've got a 2023 meta-analysis looking specifically at the safety and efficacy of very low LDL cholesterol intensive lowering. For this analysis, they only included papers where they were having intensive therapy, where they were trying to reduce the LDL as much as possible. So if we were going to see any risks, this is the paper that would show it. Instead, this analysis concluded that very low LDL cholesterol levels on intensive lipid-lowering treatments are not associated with any adverse events and maintain a persistent reduction in cardiovascular events.
Calcium out of the arteries. Also, you need that cholesterol to make testosterone.
Okay, we've got very good research from a recent Cochrane review showing that there were no differences between atorvastatin and placebo on the levels of total testosterone in males. In females with polycystic ovarian syndrome, atorvastatin did lower the total testosterone, but that's as part of the treatment.
So a lot of people on statins end up with very low testosterone.
Again, from the research that we've gone through, that's not the case.
You know, there's actually no long-term placebo-controlled statin trials. I guess they can't do them in humans.
Sorry, let's just play that again. Did he say that there's no long-term statin trials?
No, there's actually no long-term placebo-controlled statin trials.
Coming back to that large meta-analysis that we went through before, that looked at statin trials and compared them to placebo, they were followed up for an average of 6.7 years, so that's longer than the original study that Dr. Berg was quoting, so that was the Coronary Drug Project. We can also see from those studies that the more that the LDL cholesterol levels were lowered, the lower the death rates, particularly from these studies here, so let's go through them step by step. The first one ran for 5 years, and it showed that the risk of death in the simvastatin group was 30% lower compared to placebo. The next one had a follow-up period of 4.9 years, and during the study they noticed a 22% reduction in the risk of death from all-cause in the pravastatin group compared to placebo. And in the final study they were followed up for a period of 3 years, and it also showed that the statin group, they had a significant reduction in total death rates. So in this study it was 43% reduction in deaths. Coming back to that meta-analysis, those 3 studies that we went through are here. So these ones, they had a high baseline of LDL cholesterol before they started the study. So here we can see a clear benefit in terms of reducing death rates. So what Dr. Eric Berg might be referring to is that in the studies that already had a low baseline of LDL cholesterol, there didn't seem to be a benefit in terms of death rates for the statin groups.
I guess they can't do them in humans, so it's a big unknown whether statins really increase your life or not. But what we do...
So as we've gone through if you've got a high level of LDL cholesterol and you start a statin, from the research that we've gone through, it does seem to be associated with longer lifespan.
No, they have a lot of side effects, especially to anything related to your muscles. They block...
So this is a common misconception about statins. Again, let's go through the underlying research. When we have a look at a recent large meta-analysis, it concluded that statin therapy caused a small excess in mostly mild muscle pains. It affects about 1 to 2 people out of 100, and it was mostly associated with the older generation of statin therapies.
Something called coenzyme Q10 that the mitochondria needs within your muscle cells. And your heart is a muscle. And so some of the side effects are muscle wasting, okay, heart failure.
So the muscle wasting, that's been conclusively disproven from the research that we've gone through.
All sorts of achiness in your muscles, including low back pain and other types of pains. So I'm not telling you to get off your statins. All I'm telling you is to research, get the data, show this.
So on that point, let's go through some of the safety data on statins. Let's start with coenzyme Q10 because that's what Dr. Berg was mentioning. Currently, most medical doctors don't recommend coenzyme Q10 when they start statins because there's a lack of evidence of benefit. And because of that lack of benefit, the routine use of coenzyme Q10 cannot be recommended in statin-treated patients. That's not to say that you can't take coenzyme Q10, but it doesn't seem to improve any aspects of statin therapy. We've also got great evidence that statin therapy is not associated with cognitive impairment, and actually it might be protective against Alzheimer's disease.
All I'm telling you is to research, get the data, show this data to your doctor. I'll put the links down below and inform.
Equally, I'll put all the links down below to the research that we've gone through so far.
Decision based on the data versus the general consensus of what everyone's recommending.
So I completely agree with what Dr. Eric Berg is saying here. We need to go by what the evidence shows. So again, I'm going to link all of the references that we've gone through in this video so that you can make up your own mind about what you want to do with your health, because it's your health, your decision.
Concerned about your heart and you have heart issues and you're on medication for the heart, you may want to consider taking this niacin. It's very, very inexpensive. Get the extended release, 500 milligrams, take at least 1 per day. Now, if you have not yet seen my video on...
Okay, so I think we're finishing up, but we need to go through the side effects of niacin because they are quite extensive. A 2018 meta-analysis that looked at the 3 randomized controlled trials of niacin, so this is when niacin was used at dosages between 1 to 3 grams, it actually seemed to increase all-cause death rates by about 10%. In a study hoping to prove that extended-release niacin would protect against heart disease, not only did it not protect against heart disease, but it also increased the rates of new diabetes diagnoses. It increased blood sugar levels. Once again, I am not here to convince you of anything. This is just me as a practicing medical doctor in New Zealand going through the claims made in a video by looking at the underlying evidence. Personally, I take 50 milligrams of niacin, but it's got nothing to do with cholesterol. I take niacin to support a molecule in my body called NAD, which is central to our metabolism. That's a vastly different dose compared to the dosages that were used in the cardiovascular trials. They were using between 1 to 3 grams a day. And because of the lack of benefit and significant side effects, including higher rates of diabetes, that is why clinical medicine does not advocate for niacin's use at that high dosage. I hope you found this video respectful and useful, and if you want to check out the latest research on what the best diet is for human health, check out the next video here. A massive thank you to DoNotAge.org for their $10,000 donation to my rapamycin study. They are a health research organization, and to benefit from their ingredients as well as a 10% discount code, check out the pinned comment.